Hello.
Hello, this is Adam Smith calling from the Nobel Prize in Stockholm. Is this Professor Allison?
Yes, it is. Yes, it is.
Many, many congratulations on the award of the Nobel Prize.
Well, thank you. Thank you so much. I don't know what to say. I'm just stunned.
It's really wonderful this morning to wake up, and my son called me at 5:30 and was the first to let me know that I'd won this prize. I want to thank him and Pam Sharma, my partner in life and in science. We work together now trying to do something really good, I think, for people with cancer. And I believe there's an American dream, and I'm living it right now. I grew up in a little town called Allison, Texas, way down, about 30 miles from the Mexican border. I was growing up in the post-Sputnik era. You know, the Russians had launched the first satellite that went around the Earth, and, you know, there was this big feeling that America was behind technologically. And one of the things that they did that changed my life was the National Science Foundation sponsored this summer course for high school kids in biology. And I'd been thinking about being a scientist before that, but when I was in that, I was hooked. That was it. I knew exactly what I wanted to do. And what I wanted to do was have the world be a better place for my having been there. We showed that this pathway we had discovered was the first one that actually turns off the immune system, and that the tumors had a head start. You can't get enough T cells developed in enough time to eliminate the tumor, then the tumor wins. That's why I thought, well, let's just keep the T cells going long enough to eliminate cancer. And it worked in mouse models. And everybody told me, oh, anybody can cure cancer in mice. And then they said, the immune system will never work. There were a lot of skepticism. The first patient I met that had been cured of melanoma with the drug I developed. You know, she was diagnosed when she was 22 years old with metastatic melanoma with metastases in her lungs, her brain. So she was on one of the early trials and was treated, and her tumors all went away. And I met her when she was being checked up, and they said, your tumor's free. And that was a pretty strong moment. Anyway, so that meant more than anything, I think. We're curing patients now. The idea is to learn in detail how it works and bring these benefits to more patients. I still got a ways to go, but I've been able to do things that when I was a kid, I never dreamed I'd be able to do that. And I really don't know if I'd have done that if I'd grown up in some other country. I kind of doubt it, you know, had to take advantage of the opportunities that America should offer for everybody.